I have the task of explaining a fairly complex idea in about 10 minutes, so keep me honest, Mike. And just want to say before I get started that it really is a privilege to be able to stop and celebrate a little bit today. We have been working with the county for over a year, and just being able to look across the room and see all these partners, I think we've been very fortunate to have such a broad group of folks that are interested in actually moving a project from idea to action. And I think for me, that's really one of the big takeaways from this meeting, is that there's many conversations going on about Pay for Success, but there's very few communities that have actually taken that next step to explore what it would take to actually change the way government does business, and to bring those partners around the table. And I think Santa Clara really has done that, and so it's really exciting to be here to celebrate that. To get to what we're talking about a little bit, so lots of terminology: Pay for Success, social innovation financing, social impact bonds. I think it's really helpful to think about, okay, well, what's really happening here? And for us, there are two big innovations. And the first is within government, and it's really a government contracting innovation. So Pay for Success is really having the government move from business as usual, cost reimbursement contracts, either paying upfront for services or paying once they've been delivered, to saying, wait a minute, we're going to shift from paying for services to paying for actual impact or actual outcomes. And so the first real innovation going on that we define as Pay for Success is that shift in government procurement and change in government contracting. And with that, you can see, okay, well, if you're not promising to pay for services anymore and you're waiting until you see those outcomes to pay, there's a financing gap that happens. Who's going to pay for those services if government's not committing to do that up front? And so we call that sort of financing gap, or the bridge there is really social innovation financing, is how are you going to find that money to pay for the services up front so those service providers can get the money they need to get those outcomes and then get reimbursed by the government. So fundamentally, two separate things is, one is the actual contracting mechanism, how is government choosing to fund their services, and the second is how do we fund that timing gap, bridge that gap in funding. So the social impact bond, the idea that you can get private investors to cover that gap, is absolutely one way to do it. We think there could be other ways, some that are known and unknown, to finance that gap. So that's fundamentally what we're talking about today. And how does it work? So there's so many different flow charts, box charts, everything that you can look at. Wanted to distill very simply what sort of the flow of a Pay for Success transaction. And so at first, obviously, because you need to have the Pay for Success contract, it starts with the government or that person, the organization committed to pay for success. So once they have a commitment to pay, you need to raise the working capital to pay for those services while you're waiting to see if they work, and get reimbursed by that end payer. So the first step is that you raise working capital, and that could be from private philanthropists, it could be from private investors, it could be from a nonprofit themselves. You use that money to deliver services with those nonprofit service providers. And it's important to note that while you're delivering the services, there's a key evaluation component that's tracking not only the service delivery, but what's the impact that it's having based on the goals of sort of the contract holder. After a certain period of time, which on average we're seeing, it could be 2 to 5 years, 2 to 6 years, we're tracking if those services are hitting outcomes. And then at a determined point, the government will say, yes, you hit those outcomes, or no, you didn't, and they'll initiate those success payments. When the government actually pays for success, a couple of things can happen. You can use that money to replenish the working capital and repay investors, or you could recycle that money into the project. I think the only other important thing to mention here is that lots of players are involved in this. You heard me mention government as initiating, being the end payer, the investors providing the upfront capital, service providers delivering services, an evaluator who's independent and tracking impact or not. And I think what's key about all these players is that we're not looking, some people talk about this as a complete risk transfer from government to investors or government to providers. We're talking much more about risk sharing here in this situation, and that really each project is sort of bespoke, And part of the negotiation is figuring out who really bears the risk in this transaction. And does the government actually put a little skin in the game? What do providers need to be able to hit those outcomes? And what risks should they take, if any at all? And then what's the appetite and risk of the investors in the transaction? So that's a little bit of the basics. I think what's so exciting about Pay for Success is that if we were up here a year and a half ago, there'd be maybe one or two blue marks on the map. And now we've really seen that over the past year, Pay for Success has really gone national. And there are several projects that are already up and running. So it's still a very young field, but there are two projects that have been launched, one in New York City around juvenile justice, and one in Salt Lake City, Utah, around early childhood. And so you can see that some of the areas that are really gaining traction for this type of concept are areas where investments in prevention can actually avoid high-cost potential institutionalization or deep-end services further down the line. And so some of the projects that are currently in development, in addition to New York City and Salt Lake City who have launched, Santa Clara is looking at both a chronic homelessness project, as well as an acute mental health services project. Cuyahoga County is looking at child welfare foster care interventions. And then you have multiple other areas that are looking at sort of developing projects, and they're in various stages of government launching procurements and trying to look for ideas and focusing on areas really that span a spectrum of health and human services, ranging from early childhood, child welfare, healthcare, and justice. So it's very exciting. We're going national. But it's not all rosy. This is a pretty risky, it's still very new, and there's a lot of risks to this concept, and want to be really upfront about those, that we're on the cutting edge of innovation. It's also the bleeding edge, right? So it's not just a rosy picture. And I think that the risks really fall into two broad categories. You've got risks with the Pay for Success process and contracting process as a whole, and then you've got risk for the financing tool. And as an investment, this is a really risky proposition. And so at a really high level, some of these are, the most important is this is really complex. I think I encourage you to talk with Gary and with Key and some of the other folks from Santa Clara County. Changing the way that government contracts for services is a really complex process. And, there's a reason why these sorts of projects haven't been done before. And it has to do a lot in part of, for the first time we're having the data that allows us to track reliably what those outcomes are and build contracts around them. But, pulling together that complexity, finding the right data, and being able to pull together a really strong evaluation that will tell us if we have impact, there's huge risks around that. The other piece is, for a government to invest, it's a political decision to invest your political capital in doing one of these types of projects, and you have a headline risk, right? The last thing you want is you want this project to work out and to be a positive headline. You certainly don't want a negative headline out of this if for whatever reason the intervention doesn't work, or for any number of reasons. And then on the investment side, you really have a lot of, from a financial investment perspective, there's a lot of risks as well. First, there are two projects that are in the nation right now. There's no track record for Pay for Success projects. We're building that right now, but there's no sort of portfolio for investors to consider their investments. There's a huge, one of the major risks that we talk about a lot is repayment risk. These projects are 2 to 5 year timelines, and how often do politicians normally stay in office? It's true. Well, county level versus with term limits, there's a real question, right? Oh, sorry. Present company excluded. But how do we ensure that these contracts actually can stay through the full 5 year term, if you will? And then you've got the particular investors. There's a set of investors interested that are philanthropists. There's also impact investors looking for moderate returns, and then also commercial banks are potentially interested in this. Well, they all have different risk-return profiles. They all have different time horizons, and so the risks for them for a project that's never been done before with a county that's never done this type of contract, and that's a 5 year time frame is significant. And then from the service provider perspective, even if they may, and most will be getting full cost coverage, deliver their service interventions, they're subjecting themselves to a rigorous evaluation, in many cases for the first time. And so is there a reputational risk for them as well. So those are just some of the risks, and I'm sure Kimberly will talk more about some of the considerations as well. But we also think that there's, the reason that I get up in the morning, and then I know that members of our team, is that we really find that this is something worth spending our time on. And that for all the players, there really are some attractive components of Pay for Success. For government, instead of, funding programs and writing sort of clear recipes of how services should be delivered, they can move out of that sort of prescriptive mindset into only paying if there's actually impact. They get to do something that's innovative. And the contract mechanism itself is pretty innovative, right? Because when you stop prescribing how services are delivered, you can start saying, okay, we'll pay for impact and give those providers the flexibility to change what they do as the world changes so they can actually continue to have the impact and we can pay for results. Because that's what government's trying to do for our communities anyway. And government also gets to, we all talk about the data revolution, we're collecting lots of data. Government gets to put that data to use, right? And to use that to undergird contracts and actually make that data meaningful and to provide that feedback loop to help allocate dollars towards programs that are actually working. From a service provider perspective, it's the evaluation's a great perk, but they also get the flexibility to deliver services. I mean, how many times you talk to a provider and they say, we know what these people need, but the government contract we have is prescribing us to do things this way. We're not able to have the impact we want because we are just sort of following the contract. We're following the funder. Here, they're long-term contracts that give them the flexibility to reach for impact versus just to deliver services. It also provides many folks an on-ramp to government funding that maybe haven't had that before. And for philanthropists, we found that the philanthropic ask is significant here. Instead of giving a grant that with 100% certainty you're not getting back and having that serve 500 people, on a Pay for Success contract, you can use your dollars to leverage bank money to come in or other capital to say, okay, we're not just going to serve 500, we're going to serve 1,000. And oh, by the way, at the end of this 4 to 5 year period, we'll have a rigorous evaluation to know whether or not something worked. And if it works, we may have the investment from the government to continue that project or to replenish the money that we have invested in this. It's a pretty nice ask for philanthropists in some ways. From the bank perspective, it's been really interesting to see the influx of interest from commercial banks, and I think really a surprise, especially at this early phase of the field. But a couple reasons they're interested is the ability to get Community Reinvestment Act credit, so another way to make loans to high-need communities. It's a really nice communication and story loan for high net worth clients who are looking, their clients are demanding impact investments and they're demanding projects that don't just have a return, but also are having a strong impact on communities. And then ultimately, they may see a market here where they're able to sort of get more market rate returns once farther down the line, once projects have shown a track record and are able to deliver impact in a cost-effective basis. We think the biggest winner here is probably the communities that we're serving here, because taxpayers deserve, as well as communities, they deserve investments in projects that work. And now that we have the data, and now that we have those interventions that work, this is really a tool that allows us to connect those two things, create a feedback loop, and align resources towards driving impact in a new way. So that's what's really exciting to us. Without further ado, I think we'll move to Kimberly.